We at IWSP are happy to share the wonderful response we have had since the inception of the program. We are in batch 7 now, having benefited hundreds of people worldwide. Under the IWSP banner, we have a number of programs: IWSP for Life, SeriMed talks on integrated approach to health. You can visit us at myiwsp.com to know more. Integrated Wellness Science and Practice is brought to you by a team of passionate professionals working in their voluntary capacity from different parts of the globe. We begin by introducing our esteemed facilitator, Dr. Susheel Sharma. Dr. Sharma is one of the leading cardiologists in the world today. Dr. Sharma has more than 4 decades of practice behind him, at the top of his profession, as a board-certified consultant cardiologist, based out of Maryland, USA. Dr. Sharma has been associated with prestigious professional research and education organizations. He has over time been able to conceive this idea of integrated wellness, and has proven that it is possible to reverse major lifestyle issues. His amazing ability to make things lucid and simple, enabled through mastery on evidence-based research, is the most critical element, which makes this course a must for all of us. We take immense pleasure in introducing our esteemed facilitator, Swami Dayadhipananda. Swamiji is a doctor by profession, and is the force behind making integrated wellness science and practice a reality. Apart from being an efficient hospital administrator, he specializes in the practices to address complex health issues through lifestyle modifications. After completing his medical degree, Swamiji chose to dedicate his life to serve humanity by becoming a monk in the Sri Ramakrishna order. He serves as medical superintendent of the 120-year-old 200-bedded charitable mission hospital at Haridwar, India. Swamiji is an expert administrator, with his hospital serving the poorest of the poor in these difficult corona times with utmost passion and devotion. Swamiji specializes in treating type 1 diabetic children, and hundreds have benefited from his expertise. He is the pillar and spirit behind the Integrated Wellness Science and Practice program. Our colleague, Bhupendra, lucidly demonstrates the practices of integrated wellness for all of us to effectively learn and imbibe in our lives. Our team consists of senior accomplished volunteers who support in the comprehensive back-end operations to enable our facilitators to successfully conduct the program. Dr. Subroto is from CDAC, Anirban is from Volvo, Naresh is from TCS, and Karthik works for Reg Healthcare. Now, we will listen to Dr. Susheel Sharma on his views on what and why of IWSP.
People have benefited, and we're going to have. Hello and welcome to IWSP 6. I'm grateful and thankful that you joined. It's been a year since we started these programs. Over 500 people have benefited, and we're going to have a wonderful time together for 1 month for going through life transformation and benefiting and getting good health. So first of all, let me just give you a background, who I am and what IWSP is and who we are. It's been 45 years since I've been a graduate of medicine. I did my undergrad and postgrad in India and worked there for 5 years. Then I moved to England, where I did further higher education in medicine, and then started doing my cardiology fellowship. And I did specialization in cardiology in England. And then I moved to America at Henry Ford Heart and Vascular Institute in Detroit to do my super specialization in interventional cardiology. And then I started practicing in Washington, D.C. area. And I did over 10,000 of these procedures called heart catheterizations and inserted stents, did atherectomies and all kind of procedures. So all kind of blockages that could go inside the arteries, I saw them. And I saw them year after year. And I also noticed that there are a certain set of people that keep having these blockages on a recurrent basis. And that somehow motivated me to look more deeply into it. And what I found out was that there are certain set of habits, characteristics, dietary pattern, and lifestyle pattern that contribute to these blockages coming again and again. And that is what sparked my interest in prevention, and started looking into IWSP type program that I did before and started evolving on that journey. At the same time, something very tragic happened. My best friend, who's also a cardiologist in India, he was 60 years old at that time, and he dropped dead in the middle of seeing patients, most likely a heart attack. And that also sent alarm bells. And then I put everything together and found out that my father had a heart attack, my mother had a heart attack, my brother had a heart attack. So I have a very strong genetic predisposition to have heart disease. So I have to do something for it. So then I looked at all the things that are going on in prevention. And what I found out was a deep divide. And the divide was people that believed in Eastern methods of yoga, meditation, and some herbs and some concoctions and things. They believed that that is the only way to treat heart disease. And people in the West who are into medicines and procedures and technologies and bypass surgery, they felt that that is the only way to treat the heart disease. From my experience, I found out that there are good things in both. There's good things in science that obviously comes from the Western medicine, and there are very good things in our Eastern ancient practices from Vedanta, yoga, of pranayama, meditation, and yoga. So I thought, why not get both, combine them into a program and provide a comprehensive prevention program that has the best of both the worlds. And that is where the journey began. And then I teamed up with our Swamijis. Our Swamiji also, by the way, is a doctor by profession prior to becoming a monk. And he has a unique set of qualities. And the unique qualities are that he is a student of science because he's a doctor, and he's a student of Vedanta. So he brings in the ancient wisdom, the best of yoga, meditation, pranayama, being in Haridwar and training it all together. So he combined all these things together. And he also was very much interested in the same thing. So I ended up being in Haridwar. We spent a month together. We did this program together on ourselves first. And then we saw our own numbers change. Our cholesterol come down 20%, our health got better. And then we thought, why not make it a general program? And that is where Subratoji, Nareshji, and Anirbanji got together with us, and IWSP was born. And then we had 5 batches, 500 people, and very many happy people. And now we want to share the same science, same program, and same practices with you. Okay, so this is the year of COVID. I know you've heard a lot about COVID, but I am talking about COVID from a different perspective. If you really look at, this is just the data from New York, but this is echoed all over the world. If you look at the people that had the highest mortality, they had few things in common: blood pressure, diabetes, high cholesterol, coronary artery disease, old age. So if you put the top 4 of these together, hypertension, diabetes, hyperlipidemia, along with obesity or overweight, it's a constellation of symptoms which is called metabolic syndrome. And this is a strong predictor of mortality from COVID, because this is the group that has lowered immunity. So basically, if you have COVID and you have metabolic syndrome, you have a higher mortality. And metabolic syndrome also is the one that contributes to other illnesses like heart attack, stroke, blockages. So all that blood pressure, diabetes, cholesterol, overweight, this is all a component of this metabolic syndrome. And the good news is that this metabolic syndrome can be managed and treated with a lifestyle change that you're here to discuss and learn today. So some of you may know these beautiful people accomplished in their own field and done great work in the field of entertainment and medicine. And if they knew that there are simple tests available that you can do today to detect whether you do or you do not have a predisposition to have a heart attack and sudden death. And if they knew there are simple ways to change your lifestyle to prevent heart attack, these beautiful people would be with us all today. But anyway, from their tragedy, we learn a lesson. And the lesson is that we need to take care of our health. We need to do simple tests and learn them in this program that we can do to see if we have beginning of the problems that they had and we do not end up being the same way. Okay, this is one figure I want you to remember, 80%. Now that's a pretty high percentage, right? So if you really look at these 9 illnesses that I'm highlighting here, high blood pressure, high cholesterol, diabetes, overweight, heart attack, stroke, dementia, kidney disease, and some cancers. Now, some of you may have it and some of you may not have it. And those that do not have it, I can tell you, you have an 80% chance over lifetime to develop these. So what else is 80% about it? No matter how we die, we may die from a stroke, a heart attack, or a cancer, or kidney failure, or anything else. There's an 80% chance the cause of our death will be the consequence of these 9 conditions that I mentioned there. These are called lifestyle illnesses. What else is true? If you really look at all the money that you're going to spend over your lifetime on your health, 80% of your health budget will be spent on managing either blood pressure, diabetes, cholesterol, heart attack, stroke, dementia, kidney disease, cancer. You get kidney failure, you have a recurring cost of dialysis. You get a heart attack, you have exorbitant one-time cost of bypass surgery. If you have stroke, you have tremendous recurring cost of getting physiotherapy and care. And at the end, there's a good news. And the good news is that if you practice the lifestyle change that we are going to talk to you over the next 1 month in a set of 12 lectures, 45 minutes a day, giving you all the scientific data, you have an 80% chance of either managing, improving, or curing these illnesses. So if you practice integrated wellness science in practice, if you follow our DASH program that we have, then you should be able to eliminate these illnesses through change in your lifestyle. Now, you all know there's some risk factors for heart disease. In my case, is my family history, right? And as my age advances, I have a chance of getting heart attack. And also gender, I'm male. Male have a higher chance of getting heart attack. So my age, my gender, my family history is stacked against me, but none of this I can change. This is the card that I've been dealt with. But I have blood pressure, diabetes, high cholesterol that I can control. So I do not have blood pressure, do not have diabetes, do not have cholesterol, because I knew that my age and my gender and my family history stacked against me. I had to change my lifestyle and not to get blood pressure, not to get diabetes, not to get high cholesterol. How did I do it? I did it with lifestyle. I decided not to become overweight. I tried to stay active and do regular activity, exercise and yoga, eat very healthy diet, which I'll discuss with you. I don't smoke. And I try to manage stress as best as I can. But you all know stress is part of life and we all get stressed out from time to time, but I try to do my best. And this is what you also have to do with us when you do this program. So what is lifestyle briefly? It is the way you eat, the way you move, the way you have certain habits and addictions, the way you control your stress, the way you sleep, and the way you maintain relationships around you. All these, your psychosocial setup, they all have an impact on your lifestyle And this is what really finally ends up leading to that metabolic syndrome if you do not do it the right way. So is it tough? No. Look at Bill Clinton, American president. He had bypass surgery, then his bypass closed, then he had stent, and then again stent, and again stent. And he finally realized that is not the answer. The answer is to change his lifestyle. And I'll talk about who he talked to for his lifestyle change. You'll see in subsequent third or fourth slide. He called in Dr. Esselstyn to his office, who modified his diet, changed his lifestyle, and you see the change that he had. And on the right panel is one of our own. He attended the IWSP, and he was kind enough to give us his pre and post pictures, transformed. And this happened in 6 weeks. So when you do 4 weeks of IWSP program with us, you will change. Your lifestyle will change, and you will feel the benefit. And then this program that you do for 1 month then buys you a ticket to do IWSP Live with us for the whole year at no extra cost. And that is where you really see the transformation. And the transformation is as profound as the transformation of a little larva that becomes a pupa and then becomes a beautiful butterfly that flies off. This is a drastic change that you'll see in your lifestyle. And this is what is going to prevent metabolic syndrome. This is what's going to reverse your diabetes, reverse your cholesterol, obesity, high blood pressure, prevent your heart attack, prevent your stroke, treat your kidneys, improve your lungs, prevent dementia, and prevent some cancers. Okay, so let's take a few examples. Now, obviously, I can't talk about all 9 because time doesn't permit, but I'm going to talk about some of them that are common and you may have in mind. So this was a pioneer trial, and this is, by the way, Dr. Esselstyn in the right inset. He is the doctor that Bill Clinton invited to change his lifestyle. And the left panel, you're seeing some angiograms, and the white image actually is the artery. And even without you being cardiologist, you can note that some arteries in the left panel are pinched and the subsequent panel are opened up. Now, these arteries opened up not with a medicine, not with a stent, not with bypass. Dr. Esselstyn published this paper, pioneer paper, where he opened these arteries with diet alone. This was only treatment. Dietary treatment was the only treatment offered by Dr. Esselstyn. And he had patients that came to him with blocked arteries who were going to have stents put in, going to have bypass surgeries, that had heart attacks before, and they unblocked their arteries by changing the diet alone. So what was that diet? Well, we're going to talk about it. Now, this is, let's say, in the left panel is somebody who's overweight and he wants to look like the one who's on the right side. Now, first of all, let me clarify here. I do not like the word obesity. We are not doing this program for some kind of vanity or for some kind of size and shape that you need to look at. We are really doing it for lifestyle change. You could look exactly like the guy in the left panel, but you change your lifestyle and get all the health benefits without actually changing your shape. We are not here for body shaming. We are not here for vanity. We are here for transforming your life. So also, whoever you are, wherever you are, whatever you look, you're beautiful for IWSP. And you should like and you should love yourself. And this is also part of one of the practices that you'll see in stress management that we emphasize. You have to like yourself and you have to love yourself. If you don't like and love yourself, how can you like and love somebody else? And therefore, you have to practice self-compassion, and we'll have a detailed session on self-compassion, how to practice self-compassion, improve your self-image, like yourself, and love others. Anyway, so this person says, I have too much fat in my body. I have an obesity. I need a solution. I need to look like the guy in the right-hand panel. Okay, so this guy eventually looked like the guy on the right-hand side. All the fat was gone. So what did he do? Well, he had some hormone injections to burn his fat. He took some pill to kill his appetite, stopped eating, and lost weight and became thin. It didn't work completely. He had gastric bypass surgery. He made his stomach shrink. And whatever extra fat was left there, he went to a dermatologist and had liposuction done. So if you look at all this, there are modern scientific methods available to make you look like whatever you want to look like. But you have injected some pills in your body, you injected some hormones in your body, you have done some surgeries on your body, and you've done some cosmetics and liposuctions on your body. And that is what makes you look like the guy on the right-hand side. Now, all of you might think that it's a good thing. Is it good? I don't think so. Let me tell you why it's not good. Your outside may look as thin as it is, but there are problems on the inside. Now this person feels nauseated and dizzy because his stomach clipped, he has low blood sugar because there's dumping, he has malnutrition, he has some vomiting. After eating a little bit of meal, he becomes bloated, he has distension, post-surgical strictures come in, post-surgical ulcers come in, gallstones come in, hernia can happen, bowel can have problems. All these things can happen to this guy. Unfortunately, he has not reduced his risk of heart disease, stroke, and cancer. That did not change because all that changed was the way he looked on the outside, but the inside was unhealthy. And therefore, he did not get any benefit of change. So problem, he's obese. And that obesity predisposes him to metabolic syndrome, which can cause high blood pressure, diabetes, cholesterol, heart attack, and stroke, right? And that is because there is too much fat in the body that has gone in because of certain reasons. Well, what do we suggest? We say treat the cause of the cause. The fat is the cause of metabolic syndrome. Well, how did the fat get there? That cause has to be treated. And that is what we addressed in IWSP, how to remove the cause of excess deposition of fat in the body. And how do we do that? We do that with lifestyle change. And that's all this program is about. It is going to change your lifestyle. What is a lifestyle? A lifestyle is which is stress-free. Stress is a silent killer, and we all have stress. And do you know that 80% of the time you visit a doctor, that illness has some component of stress in it? If it's your blood pressure, there's a component of stress. If there's cholesterol, there's a component of stress. If there is sugar, there's a component of stress. It accounts for the third highest healthcare expenditure. And unfortunately, only 3% of physicians really address stress. We address stress in a very deep way. We tell you exactly where the stress comes from. How do you deal with the stress? What are scientifically proven methods of de-stressing and preventing the effect of stress on your body? Because stress leads to cortisol secretion. Cortisol secretion leads to obesity and truncal obesity and metabolic syndrome. So let's look at another area. Let's say you have headache. You go to your doctor, he checks your blood pressure and he says, oh, you have high blood pressure and it is causing your headache, but you want your headache to go away. He says, okay, let me check your blood pressure. Your blood pressure is 145/90. Well, you need to take a capsule, and he gives you a capsule for blood pressure. Now, let's say after a few days, your blood pressure has not come down, and that actually was the lowest blood pressure. And the next time the blood pressure is even higher, 160/100. What does he do? He says, okay, well, if it's 145/90, you need one pill. If it's 160/100, you need two. Now there's a second blood pressure pill added. Then you go back to him. Now your blood pressure is even higher. It's 175/110. Why is this happening? Because there is something that there's a cause of blood pressure that you're not treating. You're basically treating a number, suppressing a number with a medication, and it ain't going to work. Now he adds a third pill. So each pill of blood pressure lowers blood pressure by about 10 to 15 millimeters of mercury. So if you're at 175/110, you're now going to need 3 different medications, and you have to deal with their side effects, and you have to deal with their cost. This is a lifestyle study published and recommended by American College of Cardiology. If you look at things mentioned on this, it's a busy slide. Don't worry about it. We'll put it on WhatsApp for you. But each of these components can reduce the blood pressure by 5 to 10 millimeters of mercury. Now remember, collectively, if you did all of them, you improved your blood pressure by 40 millimeters of mercury. Remember, I told you one medication lowers blood pressure by 10 to 15 millimeters of mercury. So if you did this lifestyle change, you effectively eliminated 3 blood pressure medicines if you're taking. So if you're on 1, it's gone. If you're on 2, it's gone. If you're on 3, it's gone, just by the lifestyle change. And every piece of information published on this slide is backed by scientific data. So your wellness key, we say, in the integrated wellness and science and practice is our DASH program. So what is DASH? What we believe is that if you make positive changes in your diet, your activity and sleep, stress management, and habit change, in these 4 areas, if you make significant changes, that is what really you need to change your lifestyle to get all the benefits that we talked about. Now, diet, right? We'll talk about diet. Some of you may say, oh, well, doctor, I don't need to attend this program. I eat vegetarian diet. This is a study recently published in 2017, where they looked at people from Nurses' Health Study and physician studies, that people that ate vegetarian diet, but unhealthy vegetarian diet. So a vegetarian diet can be healthy plants and can also have unhealthy plants. If you're eating unhealthy plants, unfortunately, your health was worse than people that were eating animal food and meat. So just because you're vegetarian does not mean you're eating healthy. You have to eat healthy plants, healthy vegetarian diet to be healthy. And we're going to talk about that. So why should your diet change? This is Dr. Dean Ornish. And his was the very first study published in New England and Lancet. Can lifestyle change reverse heart disease? And it demonstrated by changing the lifestyle, you can actually prevent blockages developing in your arteries. This was the landmark study. And based on that, we think the first component that we have in our DASH is on the diet. And in the diet, we're not just going to tell you eat this and eat that and this carbohydrate, this protein and this fat. No, that is not what we talk about. What we talk about is the diet that makes a difference, which includes not just instructions on what to eat and what not to eat, but also how to eat. We'll take you through the anatomy and physiology of digestion, why certain foods are not good for you. Why are you having bloating, insomnia, indigestion, heartburn, sour eructations, inability to sleep, all these things that you're getting. Why are you getting them? Because you're eating wrong food the wrong way. Okay, so if I ever told you that there was a wonder drug available for wellness, it's affordable, it has no side effects, it can reduce, as published in the studies, your heart attack risk by 40%. It can reduce your diabetes risk by 50%. It can reduce your stroke risk by 27%. And it can reduce your cancer risk by 50%. And if I tell you it has no side effects and it's free, almost, would you now want to take it? Yes. And that X is physical activity. Physical activity is the closest thing we have to a wonder drug. Now, in this program, we're going to give you lots and lots of scientific studies, and this is one of them. Across the board, they looked at people that did very little exercise, some exercise, and significant exercise. And whether they had high blood pressure, diabetes, smokers, obesity, high cholesterol, COPD, everybody that did some kind of exercise more than what he was doing before had better result. All the people across the board that are active have lower incidence of blood pressure, lower diabetes, lower heart attack, lower stroke, and lower cancers. And in the activity, you're going to learn the science of activity, and you're also going to see the benefits of yoga. Now, we recommend yoga as the preferred method for physical activity, and I'm not going to talk about it because Swamiji has a detailed presentation to follow on it. but we're going to tell you exactly what kind of activity you should do, how long you should do it, how often you should do it. Along with activity, we will also tell you what is the science behind rest and rejuvenation and sleep, why sleep is important, how many hours of sleep do you need, and what is sleep hygiene. Just like there's a hygiene that you do with wash your hands and social isolation and all those things for COVID, there's a sleep hygiene. If you don't follow those hygienic sleep principles, your sleep is going to be disturbed. So if you're not sleeping well at night, wait and see the program, and you will find out very simple ways of how to improve your sleep. For stress management, we have picked up these 9 practices that we'll discuss in detail. We will discuss the scientific study behind each one of them, and we will prove to you how each one of them stand alone is capable of long-term stress management, and how you could pick 1 or 2 or 3 and deal with stress on a daily basis. Making stress go away or hoping and wishing stress go away is not living. As long as you live and I live, there'll be stress. We need to strengthen our mind and our coping mechanisms of how we can deal with stress. And we give you scientifically proven techniques for stress management. Now, habits. Now, eating again is a habit. Drinking is a habit. Smoking is a habit. Most of the things, not exercising is a habit. So this is one of the studies that we'll talk about. And this gentleman was a New York Times reporter who did some research on his own on habit and came up with this beautiful book by Charles Duhigg, The Power of Habit. And we'll talk about his habit loop theory also, how scientifically, actually, by tweaking the loop, you can change habits. We will discuss the science of habit. We'll tell you how neuroplasticity forms, how when you do certain things in a certain way in your brain, a channel forms, it gets strengthened and it becomes a highway. And no matter what you do, the information always travels on that channel. And how do you then change that channel? And that is the habit change. And what is the science behind it? What works, what does not work? You can only change the habit with a scientific way. There is no pressure, shaming, blaming, beating up, insulting does not change habits. Okay, so why should you then do IWSP? Because, as I told you in the beginning, everything that we will present to you in this integrated wellness science and practice program will have scientific data behind it. We're integrating the modern science with our ancient yoga Vedanta knowledge. And you will learn meditation, you will learn pranayama, and you will learn yoga live with Swamiji. And it's experiential. You will do it live together. And what changes we are bringing up in our lifestyle, we are sharing with each other on a daily basis on WhatsApp. What we eat, we're going to share. How much we moved, you're going to share. So this connecting and sharing and caring and learning together is really a unique component of IWSP. And that's exactly the reason why we think that you should come and listen to us. You should know the scientific facts. You should practice those scientific facts. You will then have your own experience, and then you have your experience as your best guide and motivator for you to change your lifestyle. So this program will be spent over 12 sessions. Today was the introductory session, and then there'll be a session to follow where I will discuss really what is the pathologic internal mechanisms that cause these problems. And you'll hear some beautiful new theories, new things that you may not have heard before. Chronic inflammation, which is so topical these days, how inflammation predisposes to infection. And in fact, all these metabolic syndrome patients in COVID that had high mortality also had pre-existing inflammation in their body. And there's a food that predisposes you to inflammation. There's a lifestyle that predisposes you to inflammation. So there is a pro-inflammatory way to live, and there's an anti-inflammatory way to live. You will find out what damages the inside of the lining of your blood vessels, the endothelial injuries, what is circadian imbalance, why you need to have a balanced life, and what is autonomic imbalance and how that gets corrected by pranayama and yoga. You'll learn the science of that. We'll devote 3 full sessions to diet. I'm going to talk about the anatomy of digestion, healthy and unhealthy food, how to eat, what to eat, when to eat. Every question about diet will be answered. We'll have 2 sessions on activity, 2 on stress, 1 on habits, and then in the end, I'm going to add 4 more pillars. Why you should need sunshine, how do you improve your sleep, how do you get circadian alignment, how do you know your numbers? Remember, I told you right in the beginning, if those people knew by doing certain tests where the numbers stand and what they had, they could have taken preventive measures and unfortunately not had to succumb to what they succumbed to. And we don't want that to happen to you. And therefore, we want to share that with you, that all that information. And in the end, we're going to go ahead and sum it all up for you. So remember, you owe it to yourself. What you plant today, you will harvest tomorrow. The kind of lifestyle that you have today is going to determine whether you do or do not progress to have those illnesses that we talk about. So the onus is upon you to plant the seeds of a healthy lifestyle today. And also remember, goal without a plan is just a wish. You really need to know what works and what doesn't work, and then have a plan to do that. Do not practice unscientific methods, because if the method is unscientific, the outcome will be unscientific. It's not going to help you. So see what works, see what's published, see what's good for you, and come and join us. And please commit yourself to this program. And the more we do it with you, the more we learn, and the more I research about it and share with you and benefit from you. So really, when you join this program, in a very large way, really, you're helping me also. And I'm very grateful to you for that. And on behalf of the team, I invite you all to come join us, and let's begin the session and do all this journey all over again together. And this will be a great time together for all of us. Thank you very much. Namaskar. Thank you.
Now, to join IWSP Batch 7, you can click on the link provided in the Zoom chat box, now. IWSP Batch 7 starts from the 25th of January, Tuesday, 6 a.m. and 6 p.m. India time, and the 24th of January, Monday, 7:30 p.m. US EST. We will listen to Dr. Shivakumar, Swami Dayadhipananda, on the practice of IWSP.
In this introductory, Namaste everyone. Very glad to have you all in this introductory session to the IWSP Yoga. My esteemed participants, this unique program, Integrated Wellness Science and Practice, or the Holistic Wellness Program, is very unique. We are going to learn all the scientific, evidence-based methods to make our lives better. When it comes to yoga, it's a huge topic, but here we are going to restrict our learning and sharing only to benefit us physically and mentally, so that we become disease free. At the same time, we will learn the methods to stabilize our emotions, and also we will learn some yogic methods to keep us free from stress. Above all, we will be learning some unique technique to get the joy within the meditation techniques. So, why yoga? Because yoga impacts all the 4 pillars of our dash. Dash is the basic foundation on which our program is going to run. So, diet, activity, stress management, habit change, which is the unique thing to make our life a better life, to make ourselves disease free. This yoga has all the aspects it's going to cover. That's why we have to practice yoga, not just some other physical exercises. What we are going to learn? Asanas. Asanas are typical postures in which we practice and train our physical body. These postures, which have got proven health benefits, which have got proven techniques to make you free from certain physical diseases. So, these asanas are very vital to attain wellness. We are also going to learn about pranayama. Pranayama is nothing but the technique to control our breathing, the technique to regulate our breathing. When we learn how to regulate our breathing, we are free from majority of the mental health issues. The stress aspect can be removed. The stress can be removed or cured by learning properly the pranayamas. Meditation is the ultimate medicine. The ultimate medicine for all sorts of physical, mental, emotional disorders. Meditation is the highest technique to find the joy within. Meditation should give us the ultimate rest which we all need after working in certain hours. So, we will be mainly learning asana, pranayama and meditation. Dear friends, let me tell you, based on the research papers, meditation, though known little and practiced by very few people, but the health benefit when it's learned, 75% of the health benefits are by proper meditation practice. And pranayama, also less known and practiced by less people, has more benefits than the simple asanas, the physical postures. You can see, based on the research papers, we have learned 15% health benefits from pranayama, and the physical asanas has got just the 10% health benefits. Yes, each has health benefits, but asana, pranayama, meditation, when compared, meditation has the highest health benefits and it is proven. Dear friends, why yoga, not just some gym or other exercise? It is studied and proven by researchers. Yoga is more effective. Yoga is more beneficial. Yes, it helps to maintain the health of every cell of the body, every part of the body. Whereas gym, whichever part you are using, only that part muscle is going to get the strength. Only that part of the muscle is going to increase in size. After doing the yoga, you feel energized, you feel fresh, you are not losing your energy. But after doing gym, people say, I am tired, I want to take rest. That way, it's going to affect your daily working pattern. And by practicing yoga, one feel fresh, happy, joy, all the good hormones, the positive hormones, the happy hormones are released in our body when you practice yoga. One feels tired after practicing gym because the stress hormones are going to be released in your body. Yoga can be practiced by everyone, right from kids to aged people. But the gym and other athletic exercises cannot be practiced after certain age. Yoga affects all the internal organs. It rejuvenates all the internal organs. We call it as visceral organs. Visceral organs are going to be rejuvenated. You are going to regain health. All the internal organs are going to attain a state of health. But there are no proven studies which said by practicing gym one attains health of the internal organs. And important factor in today's day-to-day life, stress. Stress has become a major factor which affects the mental and physical health of everybody. By practicing yoga, one is freed from stress. To lead a stress-free life, one should practice yoga, whereas there are no proven health benefits of gym which says it has got some psychological benefits. So why yoga should be practiced and preferred when compared to other exercises like gym, etc. When we understand more about yoga, when we learn step by step and we reach, we learn that we are not just this physical and mental combination. We are not just body and mind complex, but there is something more, energy, Atman, Brahman, God, Ishvara, Allah, Buddha. That energy is the cause for everything in this universe. That same energy runs our body and mind. Because of that same energy only, we are all connected to each other. So, we will be learning more about yoga in our whole course when we join and learn. Mainly, we will be teaching you 15 basic asanas. 15 basic asanas which have got proven health benefits. Learned and practiced properly, these 15 asanas have got immense role in making you free from certain physical diseases or disorders. So we will be learning yogic jogging, sukshma vyayama, surya namaskara, shavasana, mandukasana, shalabhasana, ustrasana, gomukasana, vakrasana, utthana padasana, sarvangasana, halasana, shalabhasana, dhanurasana and rukshasana. And every asana will be taught by our expert yoga teacher who is a certified yoga teacher, and we will also be learning about the immense health benefit of every asana based on the scientific papers. So these few asanas I am going to show you. For example, you are seeing the first one is Vakrasana, Sarvangasana, Tadasana, Mandukasana, Ustrasana, Dvibutthana Padasana, Gomukasana, Surya Namaskara and Dhanurasana. So by Yogasana, we need not worry, oh, it is so difficult to learn. No, it's very simple. Anybody, everybody who is interested to get the benefit can learn, practice and enjoy the benefits. Also, we will be teaching you main 10 pranayamas. I said by the word pranayama, we learn the technique how to breathe properly, regulation of the breathing, the prana shakti, the vital energy when it is circulated properly in our mind and body. It helps to increase the blood supply. It helps to increase the oxygen supply, proper oxygen and blood supply to every cell of the body. We have immense health benefits. So mainly we will be learning about Brahmri, Anulom-Vilom, Bhastrika, Kapalbhati, Udgit, Sarala Pranayama, Antah Pranayama, Bahya Pranayama, Ujjayi Pranayama and Omkara or Pranava. Also, we will be learning the immense scientifically proven health benefits of this pranayama. So, to show the pictures, here we see the left one sitting and chanting Om, the right one Anulom Vilom, alternative nasal breathing, the left bottom is Brahmri and right bottom is the Kapalbhati. So, pranayama has immense health benefits, more benefits than the physical asanas. Meditation is the ultimate technique. Meditation is the ultimate medicine to cure all sort of diseases, physical, mental, emotional, by attaining the spiritual nature, our real nature. When you attain that state, there is only happiness, a disease-free life. So, we are going to learn the proper meditation technique learned by our great teachers, our gurus. With that Guru Parampara, whatever we have learned, we will be learning and practicing together, and I am going to guide you this meditation session. Dear friends, with this brief introduction about yoga in this holistic wellness course, we all as a team are committed for the physical, mental, emotional health of all of you. We request you to make a commitment, invest your time so that you lead a disease-free life. You make a better choice, and also at the same time you are going to lead a better life. You are going to enjoy immense health benefits by registering and learning about IWSP, the holistic wellness course. Thank you. Namaste.
Thank you very much, Swamiji, and thank you very much, Dr. Susheel Sharma. We would now get into our the lot of questions which have come up. So, can I take your help, Naresh? If you can help me out with the question answers, you can begin.
Yeah, can you make Swamiji as well as Dr. Susheel
I'll do that
side by side so that the questions are to both of them. Also to all, if you still have a lot of questions, please keep put them in the chat box. Please try to have them a generic and about the program. Somebody has put a question on specific to their health, that we can take it in a helpline separately. It will be difficult to address individual health, health issues in this. So to start with, the first question is Swamiji. Good evening. I am type 2 diabetic since 20 years. Can I do yoga, that too front bending posture? Please suggest.
Yes, you must do yoga, and especially Mandukasana, Shashakasana, Kapalbhati. They're very useful for the management of type 2 diabetes. People who practiced yogasana, pranayama, meditation have got their diabetes reversed. We have people who are on insulin. They are free from insulin now. They are leading a very happy and normal life. Of course, each case is different. Definitely, I recommend you to practice yogasana, pranayama, meditation if you got type 2 diabetes.
Next question to Dr. Sharma. What is metabolic syndrome? I think in the early stage you put this slide.
Correct. So there's a certain lifestyle that predisposes you to inflammation that finally results in certain changes the way your body metabolizes fat and carbohydrate. And this in turn leads to a constellation of symptoms and signs that put together are called metabolic syndrome, which include obesity, especially truncal obesity, the obesity which is around your waistline. Now you see a lot of people who are very thin if you look at them, but right in their midriff, they have the truncal obesity, and that is actually one of the hallmarks of metabolic syndrome. And the other are your blood pressure, diabetes, elevated bad cholesterol called LDL, low good cholesterol called HDL, and elevated triglyceride level. So you may have 1, 2, 3, or 4 of these, but if you have 3 of these together, then you have metabolic syndrome. And the more you have, the more problem you have. And metabolic syndrome is a precursor of lifestyle disorder, the 8 lifestyle disorders that we outlined above.
So we have Dr. Srinivas also with us. He's the Dean, ESIC Medical College, one of the premium institute in India. So thank you, Dr. Srinivas, for joining in, and we're really happy to have you in this program. The next is, why you said in one of the your talk that why males are more vulnerable for heart issues. What is the reason for that?
This is just a predisposition. For example, certain types of illnesses are more common in females and certain types of illnesses are more common in males. This is just how our bodies are composed as specific gender.
Another question to you again, Dr. Sharma. I look very thin, still having varicose vein. Is there any relationship between thin and...
Correct. Correct. So overweight is just one component to varicose veins. There is genetic predisposition. If you're a female, you have a higher predisposition to varicose veins. And if your calf pump is weak, if you're not strengthening your calf pump, if you're not elevating your legs, if you're not wearing stockings, all those things can lead to varicose veins. So if you have varicose veins, you should see a vascular surgeon. There are very specific things that you can do to treat varicose veins. But the best way to prevent varicose vein is lose weight and strengthen your calf muscle. You lose weight by following the diet that we talk about in a program, and you strengthen your calf muscles by doing yoga and exercise.
Yeah, his concern is he's still he's having this issue. That is what his point.
Right. So these days, varicose veins are very easily treatable. There's a very simple endovascular procedure that can be done in 5 minutes in a doctor's office. You can go and see a varicose vein specialist, or you can go and see a vascular surgeon who can actually treat your varicose veins. You can sclerose your varicose veins either through injecting chemicals like Varithena, or doing laser surgery, or doing endovascular ablation.
Okay. The next question, maybe Dr. Swamiji can take it up. It's a generic question. Can this program help arthritis pains, back and hand? Also, can this program treat gallbladder stone? Swamiji?
Yes, in general, all the inflammation that we are having can be cured by working out all the factors that are contributing for inflammation. So in the first session itself, there is a detailed discussion on inflammation. Learn about the causes of inflammation, and definitely you will be able to get cured with all the inflammatory diseases that you have.
Okay, so you're telling, yes, it is possible. If you do a necessary modification in the lifestyle, it is possible to get rid of all these kind of problems. It's a general part, right? This is another good question I had when I joined in this program as well 1 year back. What are lifestyle disorders? It looks like every health issue are linked with the lifestyle in your talk.
Well, I said 80%, right? So 80% means 8 out of 10 disorders: blood pressure, diabetes, cholesterol, obesity, heart attack, stroke, some chronic kidney disease, chronic lung disease from smoking, chronic liver disease from drinking. They're all related to the way you think, the way you eat, the way you move. And therefore, they are an integral part of the way you lead your life. The way you lead your life is your lifestyle. And the way you lead lifestyle then determines how your inner organs are going to respond to that lifestyle. Is your lifestyle pro-inflammatory or anti-inflammatory? Is your lifestyle leading to stress or taking you away from stress? Is your lifestyle giving you poor health habits or good health habits? Is your lifestyle giving you activity and yoga and meditation and pranayama, or is making you sedentary and sit in front of the TV and imbibe all negativity that comes? And also even the entertainment, especially the soap opera entertainment that you watch, which sometimes you think is very entertaining, actually breeds negativity subconsciously. If you really laugh at somebody's misery, if you laugh at somebody looking fat, or if you laugh at somebody having a problem in the life, you really are not helping yourself, because you are then planting the seeds in your mind of creating your own misery because you laughed at somebody else's misery. So this is all lifestyle. Sitting in front of TV is lifestyle, and walking away from TV and taking a walk in the nature and fresh air and sunshine is a lifestyle. That's all lifestyle. And these are all lifestyle disorders. You'll be amazed how many health conditions happen by the way you eat, the way you think, the way you live, and the way you move. And all 4 components will be comprehensively addressed in this program.
Yes, it's my personal experience. Believe me and Anirban and Subrata sir, we all joined as a participant at the first batch, and we become a volunteer and started enjoying, because we get to know a lot of things which we never got to know this, and it was a great experience for all of us, and we have started supporting in this. Next question, we have a lot of questions. Can the lifestyle change help in reducing heart blockage, Dr. Sharma?
Yes, absolutely. My whole intention and impetus was very personal in this respect. And I shared with you my family history. My father died of a heart attack. My mother died of a heart attack. My brother had a heart attack, and my brother had a bypass surgery. And I say this, and some people think that I'm joking, or why I'm saying this. Some people may take it differently. I will have a heart attack, right? I will have a heart attack. This is my predisposition. And I told you I'm male. I'm aging every year. Every year that goes by, I'm a year older, and I have to manage my cholesterol. So I have risk factors for heart disease. Accept that as a fact. Accept that as a fact, and then find out what is it that you can do to reverse heart attack. I told you for 40 years, I saw blockages in and out. That's all I did all my life, scraping, cleaning, dilating and stenting the blockages. That's all I did. I was a plumber, cardiac plumber. And what I found out is that it only pushes the things on the side for it to come back again. The only thing that dissolves the cholesterol, that dissolves the blockage in your arteries, is your lifestyle modification. And that's what I believe in. That's what I'm doing for myself. That's what I learned from 40 years of my own experience. And that is how I am going to prevent my heart attack as long as I can, God willing. And you should do too.
Thank you, Doctor, for sharing your personal experience. Another philosophical question: how do I control stress? It is also from outside of me, right, Dr. Sharma?
So we'll discuss that in detail, and I request Anirbanji to post that last small poster that you beautifully made on that presentation that I did. We believe that as long as you're living, there is stress. There's good stress, there's not so good stress, and there's bad stress. Whether you have stress caused by you or somebody else is immaterial. The stress is eventually going to make some changes in your body, is going to interact with your parasympathetic nervous system, your sympathetic nervous system, your ventral parasympathetic, dorsal sympathetic, and we're going to talk dorsal parasympathetic, and we'll talk about that. And the end result of that is it's going to activate your hypothalamus pituitary axis, sympathetic nervous system, and lead to metabolic disorder. And this is the component of the stress that we're concerned about, how stress eats you from within metabolically. And that's what we address: the endocrine, neurologic, metabolic consequences of stress and how you can avoid them. And we give you practices, proven practices, short-term, intermediate-term, and long-term, that prevent your hypothalamic pituitary axis, your sympathetic nervous system, from affecting your internal organs adversely and preventing lifestyle disorders. So our approach to stress is completely different. We go to the core of the stress, and we'll discuss that when we discuss stress. If I tell you right now how we discuss stress, it's going to shock you, and therefore is going to probably tell you not to join, because what the treatment that we're going to tell you for managing stress is very different from what you conventionally know as stress management.
Yeah, that's one of the major issue, especially in the urban life and the corporate life, Doctor, even otherwise also. Another question, another specific question, I may not go deep into this, Doctor. My mother, aged 60, is having a blockage in artery and advised to have angioblast. with stent. Is it possible to cure through lifestyle modification without any surgery, or surgery is unavoidable?
Okay, first a disclaimer. I do not know the specific situation of your mother, and therefore I cannot make a recommendation which is specific to your mother. But all I can say at a general level is that anybody that has blockages can reverse blockages. The time scale may vary, the extent may vary, depending upon how committed you are to executing those changes in your life. And the whole premise of this program is that, yes, the blockages can be reversed and managed.
Another question, what is COPD?
Chronic obstructive lung disease. And COPD is the changes that happen in your lungs from chronic smoking. And remember, smoking is a habit. And that is how COPD is a lifestyle disorder, because you have a habit of smoking, which is the way you lead your life.
This question to Swamiji, can this program help reduce creatine level?
Again, we have to see the reasons for increased creatinine. What is the underlying kidney disease? If the increased creatinine level is completely due to lifestyle disorder, it can be reversed.
Dr. Sharma, please answer it in Hindi. Next question. Inflammation kya reaction hota hai? Sorry, I'm not good in Hindi.
Okay, so also going to what Swamiji just said, yes. So if the cause of your creatinine is blood pressure and diabetes, uncontrolled diabetes, uncontrolled hypertension are the two of the commonest reasons for high creatinine, other than other diseases of the kidney. And if you correct your diabetes and you correct your blood pressure, then yes, creatinine will come down in those cases. So what was the question that you wanted to address me in Hindi? Inflammation kya hota hai?
Inflammation
reaction
क्या होता है?
ओके, साधारण भाषा में इन्फ्लेमेशन मतलब सूजन. जब आपकी उंगली को चोट लगती है, दरवाजे में आती है तो फूल जाती है. इसी तरह अंदर के शरीर के जो आपके ऑर्गन्स हैं उनमें भी सूजन आ जाती है. देखिए, बहुत ज्यादा अगर आप शराब पीजिएगा तो आपके दिल, आपके जिगर में सूजन आ जाती है, राइट? इसी तरह अंदर कोई चीजें हैं, कोई खाना भी ऐसा होता है जो आपके अंदर सूजन करता है. आप स्मोक करते हैं, उससे सूजन होता है. अगर आप बहुत बैठे रहते हैं एक जगह से, उससे आपके अंदर सूजन होती है. पर वो सूजन दर्द नहीं करती, तो आपको पता नहीं लगती, और वो लगातार सूजन जो चलती रहती है उसके बाद वो बीमारियों को पैदा करती है. वो बीमारियां होती हैं, ब्लड प्रेशर बीमारी होती है, शक्कर की बीमारी, बीमारी होती है कोलेस्ट्रॉल की बीमारी, बीमारी होती है आपकी जो धमनियां हैं उनके अंदर जो है वो कोलेस्ट्रॉल जम जाता है, जिससे आपको उसके बाद हृदय रोग होता है, उससे आपको हार्ट अटैक होता है, उससे आपको फालिज होती है. उससे तो ये सारा कुछ जो है, ये सब कुछ, इसको इन्फ्लेमेशन सूजन कहते हैं. बाहरी सूजन आप देख लेते हैं, उसको इलाज कर लेते हैं, दवा ले लेते हैं. अंदर की सूजन पता नहीं लगती है. अंदर की सूजन खाने से आती है, अंदर की सूजन गलत तरीके से सोचने से आती है, अंदर की सूजन बैठे रहने से आती है, और उस सूजन को भी अंदर से ठीक करना है. उसको, वो बहुत इंपॉर्टेंट है, और उसको जो हम एड्रेस करते हैं इस प्रोग्राम में, वो आपको सीखना है. और अब अंदर की सूजन जब आप खत्म करेंगे तो आपकी सोच बदलेगी, आपका भोजन बदलेगा, आपका विचार बदलेगा, आपका व्यवहार बदलेगा, आपका स्वभाव बदलेगा, आपकी जीवन शैली बदलेगी, आपकी जीवन पद्धति बदलेगी.
Thank you, Dr. Sharma. This is a comment from one of the participants. Can I consult personally to Swamiji for back pain issues because of which I cannot do any type of exercise or asanas? Yes, please do connect with the helpline number which we have already posted, and we will get Swamiji talking to you based on his availability and your availability. Next question, quite interesting, doctor, for all youngsters. I'm 23-year-old young adult, healthy adult. Why should I attend this program? How is it going to help me? I'm already good.
So this is a very important question. So I begin with, first of all, telling you a very little historic thing. You know, there was a war, Vietnam War, that America fought for a long time. And they had to have lots of soldiers, and a lot of young people went to war. 18, 19, 20, 21-year-old people went to war. And unfortunately, there were some casualties because they got killed, and they got killed by shrapnels or bombs or those kind of things. And as is a practice in America, every soldier had a postmortem. When they did the postmortem, what they found out is, although yes, the cause of death was the injury from the shrapnel or the bomb, but they also had blockages in their arteries. So that the first time they found out that the blockages that cause heart attack at the age of 50 or 60 or 70 have actually their beginning when you're 10-year-old, 15-year-old, 20 years old, 25 years old, and 30 years old. How? Because the way you eat, the way you think, the way you move, the way you sleep, and the way you lead your life leads to deposition of these particles called cholesterol inside your arteries and cause inflammation that begins very early in life and progresses. So actually, 43-year-old, 30 years old, 20 years old is actually the best age to start that, because when you start taking care of these blockages when you're 20 and 30 and 40 years old, that is the group that's going to live 80, 90, 100, 120, 140 years from now. You heard about these yogis that used to live 120, 140 years, right? You're surprised. It is a fact. They did. Yes, it's historically documented. So that is why it's important for you to change your lifestyle now so that you don't end up to a stage where my father, my mother, and my brother got to. And if I wish I was as enlightened as you are at age 43, sitting listening to this program, I was not listening to these kind of programs when I was 43 years old. So I'm glad that you're more enlightened than I am. And yes, it is going to help you.
Thank you for the enlightening answer. Better let us join. All the youngsters, please do join. Don't miss it. You answered part of the question, but the part of the question is, what are the reasons for BP?
So high blood pressure that you have, when you go to your doctor, he'll tell you 95%, they call it essential blood pressure or primary hypertension. They say there is no cause. And for 5%, there could be an endocrine cause, a kidney cause, or those causes that they treat. So this is how conventional view of hypertension is: essential or primary, and secondary to a cause. What we teach you in IWSP is that what the doctors call primary or essential hypertension, there is a cause for that. And the cause is in the lifestyle, because we proved to you by that slide that I showed you, and we'll go through that in detail, that by instituting certain lifestyle changes in your life, that 8 practices that I listed there, each one of them lowers your blood pressure by 4 to 5 millimeter. You can lower your blood pressure by 40 millimeter of mercury. So if your blood pressure is 160 systolic and 100 diastolic, without any medicine, you can bring it down to 120 or 130 systolic and 80 to 90 diastolic. So therefore, although we do not know what the cause is, okay, we admit, like the modern medicine, we do not know what the cause is, but we know what the treatment is. So if you change your lifestyle, you can treat your blood pressure.
Yeah. So there are some generic points. Someone was asking when it starts and when it ends, and is it available recordings? So here is the answer for all. The program actual day 2, that is today's day 1. The day 2 starts on 25th January and ends on 17th February. You all will get an email with the timetable of this. 25th January is when it starts. 17th February is when it ends. Every week, Tuesday, Thursday, Saturday, we have 3 days: Tuesday, Thursday, Saturday, morning 6 to 7:30. Same repeats evening also, India time, 6 to 7:30. So if you're in US, EST, PST, you can calculate accordingly. Another question was, do we have recordings? Yes, we do have an e-module from this time. So whoever registered the program, everybody will get an e-module access also. It is not necessary that you need to, if you want to have a live question, you have to join in the live program. Otherwise, you can view the view module also, so that you can multiple times you can listen. So we have a slide on this. So just wait for it. I'll close other questions. Please tell me back pain issues. How do we handle this issue? Again, it's a specific question. You requested to connect with our helpline. We will take the necessary advice from Swamiji on any yoga practices related to this, ma'am. Swamiji, this question to you. Will the yogic asanas and pranayamas introduction be possible for elderly people with the knee replacements?
Yes. People who are undergoing knee replacement, during the part of the treatment, they're advised to do all the exercises to strengthen the muscles around your knee. So we teach all the yogic practices which help to make the muscles around knee strong. Thereby, it will help the people who have undergone knee replacement.
So yeah, please join the program. Another question, again, not specific to any doctors. The person has got quite a bit of problems. Please do join this course. Dr. Susheel already connected with the BP, varicose vein. So please join this program. Definitely this will help. The next question, I have thyroid and take heavy dose of medications and when to get rid of it and want to get rid of it. Can this be reversed and get away with the medication, Swamiji?
Yes, people who used to take a lot of medicines for hypothyroidism, by practicing all the good habits, by changing the lifestyle, the medicine for hypothyroidism came down, and in some people it also got completely. We had to stop the medicine for hypothyroidism.
We do have some Pranayamas, Swamiji. Yes, doctor. Sorry.
Yeah. So one more thing I wanted to add. Anything that ends, medically speaking, with 4 letters at the end called ITIS, itis. All itis is inflammation. This is the Latin word for connoting, let's say, thyroiditis. That means thyroid is the gland, and there's itis, inflammation in that, and that's what led to thyroiditis. So before you get hypothyroid, you have thyroiditis, and then it burns out, and then you end up becoming hypothyroid. So all these inflammatory disorders are affected by that.
We do have some pranayamas, right, Swamiji, to address this.
Yes, Vijay Pranayama is very helpful for hypothyroidism.
We have covered in this program Ujjayi Pranayama also in a very detailed way. So please do join and we will get a clarity. Another question is, this person have joined our diabetic session also, Dr. Susheel, and he's asking, I'm having a doubt in, can central obesity causes diabetes?
Absolutely. Actually, the type 2 diabetes begins as central obesity. And I don't know if you attended our recent diabetes program or not. There are 3 ways. One is obviously there is inflammation. The second way is that this becomes actually an endocrine organ. Central obesity, they have found out, secretes certain hormones that have deleterious effect on your body. And the third is obviously the extra fat that gets stored and the extra sugar that gets stored leads to insulin resistance. So insulin resistance, inflammation, and the hormonal effects of the truncal obesity, which starts acting as an endocrine gland of itself, are the 3 main reasons how truncal obesity contributes to central obesity. So absolutely, it's paramount that if you want to cure your diabetes, you must work to reverse your metabolic syndrome by treating your truncal obesity.
Yeah. Next is more of a comment, Dr. Sharma. You may also reflect. Changing habits is the most difficult part.
And I agree. And I tell you that there are certain habits in my life that I changed over 6 months, certain over 6 years. And very recently, I changed one after 20 years. So it takes a long time. It takes very long time to change habits. But there is a science behind habit change. And if you follow the science and persist, it will change. And how long does it take to change a habit? It depends upon how long have you had the habit. The deeper it is ingrained in your mind, the longer it is going to take to erase it.
Anirban, your help on a question in Hindi?
Yeah, I mean, हम कैसे सही कर सकते हैं अगर लो शुगर होना फील नहीं हो रहा हो तो? I mean, I did not understand the gist of it, but Swamiji, maybe
somebody is having type 1 diabetes and getting repeated attacks of hypoglycemia. After some time, they will
Swamiji, sorry, if you can Hindi. Swamiji, sorry.
Yeah. सो कुछ लोग होते हैं जिनको टाइप 1 डायबिटीज है बहुत सालों से, बार बार उनका शुगर लो होता है, हाइपोग्लाइसीमिया जिसको बोलते हैं। तो बार बार जब शुगर लो होता है, जो लो शुगर के सिम्टम्स हैं वो उनमें दिखाई नहीं देता है। हाइपोग्लाइसीमिया अनअवेयरनेस हम जिसको बोलते हैं। इसको कैसे हम ठीक कर सकते हैं? अपना शुगर ठीक रखो। जो भी टाइप 1 डायबिटिक हैं उनके लिए हमारा यही एडवाइस है कि आप सुबह फास्टिंग, दोपहर खाने से पहले, रात को खाने से पहले अपना शुगर चेक करो, और शुगर लो ना हो उसके हिसाब से आपको अपना इंसुलिन जो है एडजस्ट करना होगा। जब आपका शुगर नॉर्मल रहेगा तो कभी कभी एक बार आपका शुगर लो होता है तब का एहसास होता है। तो एक ही उपाय है अपना शुगर को नॉर्मल मेंटेन करना। अगर आप अपना शुगर को नॉर्मल मेंटेन करना है तो खाने के हिसाब से इंसुलिन लेना है। जो इंसुलिन ले रहे हैं उसका डोज भी आपको खुद को एडजस्ट करना सीखना है।
Thank you so much.
Thank you.
Another question on similar diabetic one. It's more of a doubt. Does controlled diabetes means the one controlled with medicine? Swamiji?
Yeah, it's up to you whether you want to keep your blood sugars in a normal range by taking medicine or without taking medicine. So if you want to get your blood sugars in a normal range without taking medicine, you have to see what are the lifestyle disorders that are contributing for the increased blood sugar. So you have to make a choice whether you want to take medicine or you want to improve the lifestyle disorders or bad habits that you have. So definitely both can be worked out. Blood sugar can be kept in normal range either by taking medicine or by practicing all the good habits to keep the blood sugars in a normal range.
So, I mean, we have a lot more questions still. So it shows a lot of interest. Please, I request all of you to join. We may not be able to address all the questions. We'll take 1 or 2 questions more. Doctor, people who's having low back pain, do you advise them to join the program? Yes, we have already answered this. Please do join. There are some your asanas specific for you which will help. For diabetes, what is the frequency we should get our BP sugar level? Sorry, for diabetes, at what frequency we should get our BP sugar level and other parameters get checked? Swamiji?
If you are diabetic, HbA1c once in 3 months. अगर आपको डायबिटीज है 3 महीने में एक बार आपको HbA1c कराना है. HbA1c is average blood sugar of 3 months. And if you are hypertensive, I think at least once in a month you should have your blood pressure checked done. And if you have got any other comorbidities, also you have to look for that. So if you have got hypertension, if you have got diabetes together, maybe your cholesterol is also on the higher side. So complete profile once in 3 months, I think that's fine.
Thank you. One last question, Dr. Sharma, this is for you. Metabolic syndrome will have genetic basis. How to control it?
Okay, so we addressed this comprehensively during our program. So if you really look at all the health problems that happen, the basis of all of them either lies in some extraneous factor that leads to disease, in some internal metabolic processes that lead to disease, or some genetic predisposition that leads to the disease. So the genetic predisposition simply means that there is a chance that that genetic composition that you inherited from your parents may or may not lead to that disorder. Now, we will discuss in detail that there's a difference between genetic inheritance and gene expression. There's a lot of research now about gene expression, and we will tell you about the studies where you will find that meditation has been shown to modify gene expression. You may have a genetic predisposition, but that predisposition will not express itself as a disorder just by doing meditation. So it's complicated. Just because you're genetically predisposed does not mean that you will have it. You can prevent that and its expression by meditation and lifestyle change. And that is what this program is about.
Thank you, Dr. Sharma. Thank you, Swamiji.
Thank you, Dr. Sharma. Thank you, Swamiji. I think we have shot by 1 minute.
So one little question that was there, let me just address that. I saw that just it's a 10-second question. Yes and no. Somebody said, is COPD a metabolic disorder? COPD is not a metabolic disorder, but it is a lifestyle disorder. So you will not have COPD if you have truncal obesity, but you'll have COPD if you smoke, and smoking is a health habit, and therefore it's a lifestyle disorder.
Okay, great. Thank you, Dr. Susheel. I think we would have missed that. So thank you, Swamiji, and thank you, Dr. Susheel, for this wonderful session. And before I close, one slide which I wanted to just show so that you are able to join the program eventually after listening to both our esteemed facilitators. I'll just share my screen, and once this slide is shared, we'll close the meeting with this. Thank you, everybody, for joining in. But before we close, please have a look at this important information.
In order to sustain the back-end activities, like IT and system support, there is a small token fees. You can go to myiwsp.com and enable the payment through the QR code and other such simple means.
So this is the sample of the QR code.
The Google Pay QR code in the myiwsp.com. You can click on the link and register for the program.
So thanks a lot. And these are our details when it comes to the website. And you can go to the website. It's very simple. The website is also very simple. And you can look at it and you can go through the pages and register yourself and make this small token payment just to sustain the activity. As we said, we all are volunteers. And this is basically for the backend, IT and system, so that we are able to efficiently run this program. Thank you very much.
Our team will be connecting with all of you, sharing all the details in the next 2 days.
Yes, we will be connecting with all of you in the next 2 days. Thank you very much, and look forward to see you, all of you, on 25th of January, Tuesday, for a enriching next 11 sessions of where our two esteemed facilitators will be taking us through some important changes in our lives. Thank you very much.